Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, welcome. It's great to have you here. We're having some fabulous conversations with real leaders that are painstakingly reshaping the future of healthcare. We're pretty passionate about a few different areas. We're passionate about innovation and leadership, access, and the actual adoption of these innovations within these work streams. And if it's your first time tuning in, let me just sort of take a quick step back and dive in a little bit deeper in terms of like what are we really trying to get done here? So we're focused on bringing real stories of innovation and leadership to life, not just the stuff that you read in articles, but like real people that are actually in the trenches getting stuff done, learning about the little wins, and obviously learning about some of the things that haven't gone their way, because when you're innovating, you're not actually winning most of the time. So we want to learn from those learnings and share those with our community and ultimately with the world. So, wherever you're watching this, if you're watching it, if you're listening to this, however you're consuming it, hit the subscribe button now so that any new episodes come directly to you. So, there is a version of healthcare innovation where like a big health system writes a check and to a startup and then puts out a press release and then calls it a day. And then there's another version of that, which is what today's guest actually does. And I am so excited to actually share this. So, Steve West is the managing director of Healthliant Ventures, the innovation arm of Tanner Health, a five-hospital system serving Western Georgia and East Alabama. And I think what makes Steve different is that with what they're doing at Healthliant, they're not like a lab. They're different from a fund. It's sort of this live clinical environment where healthcare startups actually get to prove themselves. You've got real clinical staff, and then you actually end up getting a real verdict as to whether or not the technology that someone is trying to deploy actually works. It's a really beautiful thing when it works real well. And we're going to get a chance to kind of peel that back today. So before this role, Steve has had some really amazing tours of duty. He was CEO of Fiona Tech, sort of a no-code data management platform that was acquired in 2023. Before that, he was inside some of the big boys inside of Anthem, and then he also started off his career at the advisory board. So I think that's really interesting context for what we're going to talk about today, which is what does it take to build inside of a health system where there's a lot at stake? Things go wrong pretty quickly, but what are the aspects and the things that we need to have in place foundationally in order for things to go really, really well? So if you want to get a shot inside of a health system, or you're trying to, without spending 3 years to try to land a meeting, this is the conversation that you're going to get value from. So, Steve, great to see you. Welcome to the show.
I appreciate it, Michael. It's great to be here.
Awesome, man. Hey, before we kind of just kind of dig into the work stuff, kind of have a question about sort of how you grew up. Who were you as a kid? Before you're managing director of Healthline, like what were you like as a kid? How'd you grow up, and how'd that shape you?
Yeah, well, I grew up in North Carolina, in kind of the Triangle area. So, to two parents, one was a professor and was in public health. The other, he'd just been in business his entire career, actually, in smaller businesses, so medical technologies or
Mhm.
therapeutics and a few different things. And, I grew up in an environment where there was always a lot of curiosity. There was a lot of learning. I was one of those Lego kids, always trying to put something together and,
Yeah.
figure out something new. And, for me, I thought that was incredibly exciting, is just to kind of build something out of nothing. And so I think
Mm.
that's what led me to my entrepreneurial journey, a fair amount, is just that background of, well, what's next? How can I get involved in the things that are just the tip of the spear?
Yeah.
And, but that's the funniest part, is I actually never really intended to do that. it was always something at the back of my mind. I actually,
I
one of
think it
my
was just
most
like a natural
interesting.
evolution. It's just
It
naturally
was a
evolved into
natural.
that from a
I
progression.
think I came back to it. I think I came back to it because one of the more interesting things, and I had a bit of a side kind of mission at one point, is I thought I wanted to get into diplomacy. And
Mm,
when I was in high school, I was an exchange student in Russia for a while. And so like this was like
interesting.
early 2000s. You're kind of going out in the middle of the country. I wasn't in Moscow or St. Petersburg. I was in like the hinterland, right? And so you're
So you speak
figuring
Russian?
out, I used to, not anymore. I don't practice it nearly as much.
Okay.
You don't use Russian nearly as often in a health system environment, Michael. Darn.
Yeah.
But,
Yeah.
I was like, hey, I'm going to study this. I went to school to study Russian politics, economics. I got really deep into understanding just crazy organizations and their incentive structures and all the things that can break down. And I said, okay, well, I'm gonna do this as my job. And boom, I graduated 2009 and nobody's hiring. And I get
Interesting
back at
times.
interesting times. And,
Yeah.
I went down to Washington, D.C., trying to figure out what I was going to do. And luckily enough, I had a colleague that worked at the advisory board, and they took a shot on me, and that's how I got into healthcare from thinking, hey, I was going to be on the other side of a negotiation table with a bunch of Russian politicians. Just life comes at you really fast, and you
Yeah.
never really know the types of things you get up to.
You know, the advisory board is sort of an interesting choice to go right out of school. I feel like you're probably fortunate for that. Um, I think a lot of people go
Absolutely.
into consulting trying to figure out what they want to do. Uh,
Yeah.
were you doing that, or did you kind of already know that you wanted to sort of just fully stay in healthcare?
I think I was still trying to figure out what I wanted to do. I think that there was a little bit at that time of desperation. If I could be completely honest, I mean, it was 2009. Not a lot of people were hiring, and at that point, especially entry level folks. And I had a
Mm,
great background. I knew how to write. I knew how to talk. At least I thought I did to the level of what I needed. And the advisory board was an unbelievable organization that shaped a lot of people from a really early stage of their career. I mean, almost everybody came in doing sales or account management or
hmm.
consulting or research, and they gave you a lot of the tools needed to execute at a very high level. I mean, I still keep in touch with a lot of my advisory board colleagues, and I look at them as some of the preeminent folks in this industry. And
Yeah.
I learned a lot of things that I could use and I still use today. It's just an unbelievable environment. And so it was very fortunate in that
Yeah.
regard.
It's just amazing to see how, like I said, things shape you over time, and then you kind of go back and you look and you're like, look, those principles that, you know, I was taught, I still use today, and they still work today. That kind of goes to show you how it's cool when things last.
Yeah. Well, and you never really think about it. I mean, one of the first
Yeah.
consulting organizations at the advisory board I was in was actually not even on the healthcare side. It was on the higher education side.
Mm,
And, they were kind of doing this as like a nifty side project. Eventually it became the Education Advisory Board, which is a large company in its own right. And it was all about supply chain management. We were
mm,
retrofitting an old platform for healthcare into the data reality of higher education. And the
yeah.
reality was is we had very limited development time. We had to figure out how to use this analytics platform to drive value for an educational institution that was like, well, we don't really know whether these guys are going to be the right
Yeah.
guys. And
Right.
so it was me trying to build out products from Excel analysis the entire time to try to say like, hey, this is your next opportunity. This is your next opportunity. This is your next opportunity, and
Mm,
just trying to hack and slash your way to providing value. It was the thing that got the next person on board, the next organization on board, the next organization on board. And you realize how much it's like these organizations rely on the ingenuity of a few different folks. And I'm not going to say that I was the ingenuity
right. Right.
driver
Right.
of
Right.
this, but
No.
it was just us young consultants trying to just figure it out and make it work, and eventually became a pretty interesting business. And I still have a lot of folks that are at education advisory board that started in that same team they're now leaders in that organization, and kind of that formative experience gave them a lot of different interesting paths in their lives as well.
That's interesting. I just remember from our first conversation that we had, the first thing I thought, I was like, man, this guy's a product guy. He loves product because in a couple, pit stops after advisory board, you end up at Anthem, in product, which is sort of a slightly different world. Big, big system, uh, bureaucracy, politics. What I'm just curious, sort of what did that tour of duty teach you that like nothing else could have
Ooh.
taught you?
Anthem was a really interesting one because, I had been in product a little bit earlier on,
Yeah.
kind of the day-to-day writing stories, trying to talk to customers, figure out what the needs were, all of that. And I moved up and went to Streamline Health and started running products and,
Yeah.
interacting with executives in terms of getting information to the forefront and driving the strategy there. But it wasn't until Anthem where you realize how hard it is to do this at scale and across
Yeah.
multiple different organizations. And so, I was recruited by an old advisory board mentor, and he's an unbelievable product guy, and I could learn a ton from him. I said,
Right.
okay, well, I think this is going to be interesting. I don't know what to expect. It's this diversified business group. It was at the time they were trying to build the Optum at Anthem.
Hmm.
And they had said, well, we have a partnership with a little known company that is a massive EHR vendor in this space. And you may know who they are. We're going to build a joint venture out of this. And I was like, okay, this seems really cool. We could absolutely change the industry if we create a longitudinal health product that has the best information from the clinical data with the EHR with all of Anthem's claims data.
Yeah.
But you realize how much culture change needs to happen to not just make one company work, but two massive companies working in partnership together work.
Mm.
It's like, well, how do
Mm.
you bridge the gap between folks that may not have ever actually sold things before, right? They're just
Yeah.
used to building product in the back, and they say, okay, well, the customer's going to come. How do you figure out how to, talk to people when they have no incentive to do it? And it's creating those types of moments where you can break away some of the tension.
Yeah.
That becomes the real hard product work. And I would say that I wasn't successful at it. I mean, the actual partnership
Mm.
itself didn't last. And eventually, all of the folks that were on that SWAT team making it work kind of moved to different parts of the organization. And eventually, most folks left. They're in leadership positions in a lot of different other places. Just an incredibly talented team that knew what they were doing, but yet the circumstances underneath the incentive structure just didn't make it work.
Mm.
And that's really hard to stomach sometimes. And it's like you've got all this opportunity, you think it's going to do it,
Yeah.
and then like it just falls apart in front of you.
How do you kind of deal with that? I guess in a sense, that loss. Did you kind of grieve it a little bit? I mean, what was that like?
Yeah. Yeah, you had to. There were some parts of the organization that were still trying to push this forward. I mean, you had a huge strategic shift when Gail Boudreau took over from Joe Swedish in that regard. And a lot of the folks just, that the focus of the organization more broadly went back to being a payer as opposed to, kind of a technology provider.
Right. Right.
Um, you still kind of make it work. Eventually, though, you have to say, okay, am I going to live in this new reality in the place that I am, or am I going to start something different? Am I going to think about something different? Because you can get depressed being in a large organization that doesn't necessarily value you in the same way that they may have valued you when you came on board. That's a
Yeah.
really hard thing to process. And that's ultimately what led me towards, working with my co-founders at Fiona. Is like, well, this was the thing on the side that I was doing while I was trying to figure out my Anthem gig. I think I'm far enough in the future now that that's no longer a concern on a non-compete. But, that was the thing that, brought me there and brought me back was like, okay, I can get back into this entrepreneurial mode because that's
Yeah.
what I started doing at Anthem. It moved away from that, but I always got drawn back into kind of that new product type of fit.
Yeah. I mean, in
Um,
essence, you were you were being very entrepreneurial, doing something entrepreneurial inside of a larger organization. which is great because there are bets that you can take, and you're
Yeah.
underneath the umbrella of this. I'm just sort of curious when you kind of went full on into Fiona, like what was going on, in your head when you were like, all right, I'm all in on this, when you kind of decided to do it.
Yeah, we started getting a lot of really good customer feedback on it. Like originally it was a side project. It was meant to be a healthcare data play. And we were going to connect into the
Yeah.
EHRs. We were going to try to sell this. This was pre-chat GPT. We had built like an
Yeah.
Elasticsearch cluster to try to do natural language search on like incredibly unstructured data. And we were like, okay, I don't know if this is really going to fit on the healthcare side, but I've been in healthcare most of my career. Do I want to be on healthcare
Yeah.
again? Like maybe we make this data platform work, for SMBs a little bit more. And we started getting more of the traction with customers on that side. We kept building it, we kept kind of bootstrapping it forward. And eventually it got to the point where the thing that I was running away from was not nearly as exciting as the thing I was running towards, which was this
Mm,
opportunity with Fiona. And I think that a lot of people tend to look at it that way. It's like it's just risk mitigation. I mean, I had a great job, good income, all of that going into something that like wasn't necessarily going to pay the bills, but it was something we could own and build. It became exciting enough that I couldn't ignore it.
uh, how fascinating. Because you've sat in the seat, I guess like you get the opportunity to ask you this, like what's the hardest part of being a healthcare startup CEO that nobody really warned you about?
Nobody warns you about the waves. And what I mean by that is it's just the wave of exhilaration when something goes well and the wave of despair when something goes wrong. And it's just such a crazy, crazy oscillation back and forth because it can all happen even in the same day, in the same 2 hour
Yeah.
period where you have a great call and then you have something terrible. And I think that that's the thing that even now, like coming from more of like the, investor health system side, it's like the one thing that I can relate to with a lot of these companies is just the feeling of this can go really great one day and really poorly the next. But
Mm,
the fact that you've been there, you've seen that, you can speak to it with just a level of candor that I think most folks can't.
yeah.
Because like you have to figure out it's like, okay, am I going to be able to hit payroll this week? I don't know. Am I going to be able to deliver this for the customer in this time? Like we're going to have to step, we're going to have to figure out how to do this. Like I got this one shot with a decision maker and he just didn't show up to the meeting. Like there's so much anxiety and that the waves up and down are just the things that you can't really internalize until you've been there. I mean, even if I
Yeah.
say it to
Yeah.
somebody, and I'm sure in your own business, Michael, right? You
Yeah.
felt that same thing. It's like,
Take
you
hits.
have to have you take hits and you have to have a strong family structure. You have to
Yeah.
have good friends because it's really lonely going after the thing that you're like, I don't know if it's going to work.
Mm,
And it's almost tougher when you're bootstrapping because you don't even get some of the external validation around VC funding or anything of that nature, where it's like, yeah, some important guy believed in me so much that they gave me money to keep doing it.
yeah.
Um, those are the wins that keep going, but you know, sometimes few and far between.
Yeah. That's why I always say, man, measure the little wins. Got a little win jar here in my
Yeah.
office, and I always like put stuff into it. It's because if you're having a crap moment, crap day, crap week, dip your hand into the little wins jar, read a few of them,
Yeah.
get you set up
That's a
again.
great idea. That's a great. I
Yeah,
should I should do that for my team because like we get a lot of hits at the health
little
system. That's
win
because
jar,
it's the
man.
same thing. There's a lot
Yeah.
of different things that happen in a health system. As great as a place as Tanner is, there's a lot of hits too, and that's just the name of the game.
All right. So I mean, so Fiona gets acquired. You end up as managing director. How does that happen?
Yeah. I was trying to figure out, we were in kind of our last phases of integrating into the new company. And I saw this kind of interesting job ad because I was looking for something a little different. I was like, do I want to go back into product? Do I want
Yeah.
to it's kind of the same thing over and over again. It's just different companies, similar types of problems. Like product is a vocation in that way, but unless you're seeing leadership, like moving things
Yeah.
forward from like
Yeah.
being a startup founder, going back to humdrum like product is like, okay. I still
Yeah.
have a
Yeah.
boss. I still got to deliver to a KPI.
Right. Yeah.
And so I saw this, this posting for this, principal position at Carrollton, Georgia. It's like, Carrollton, Georgia. Where's Carrollton, Georgia? And the funny thing is, they have all the LinkedIn of like people from your school went there. And I went to school in upstate New York. It's very rare to find somebody that went to school at my school that is in the Southeast in health tech, in technology. And I
Yeah.
was like, okay, this has got to be some sort of sign. And so I messaged Jay Brennan, who's the COO of Pronovo, and we had a talk. And he's like, Steve, I think it'd be perfect for you to join Tanner and kind of run this office. And I want you to talk to Greg Schulenberg, who's the CIO there. He was the former COO of Greenway when, all the way from when they started to going
Yeah.
public and then eventually taken private in private equity. And we'll see if it's a fit. And
Yeah.
but like I remember after having that conversation with Jay the first time, I was like, wow, this could be something really cool. I have no idea what I'm getting into,
Yeah.
but it felt like that moment going back to Fiona a bit, where it was like I'm running to something rather than just trying to figure out like these product jobs could be something. They'll pay the bills. I mean, this
Yeah.
could be something very different.
All right. So let's talk about what Healthliant actually is, because when I explain it to founders, um, admittedly, they they think it sounds too good to be true. Um, Break it down for me.
So Healthliant, I mean, and we've somewhat evolved this model a little bit. I mean, it's a
Okay.
broader model is around. I don't have a thesis as an investor or a partner other
Hmm.
than I need to solve the most pressing problems that my health system has with, company solutions that may need a little bit of extra oomph to get them fully the way there.
Okay.
Because, the background of this, and every health system starts a venture office for a different reason. But
Hmm.
the reason that Loy Howard, our CEO, started the venture office was he's like innovation at Tanner, and I'm sure this is the many different places in the health systems nationwide. Innovation happens in a very small bubble. You have these
Yeah.
wide visions from the C-suite that says, "Oh, we're gonna disrupt ourselves. We're gonna do all of these different things to make it work." But it's hard to get that down to the ground floor. The managers, the directors, the
Yeah.
ones that are actually doing it.
Hmm.
They're allowed to innovate with their existing vendors and maybe get a little bit of extra contract value to them or doing a little bit of a lean process to change it up. And at the end of
Hmm.
the day, they don't actually see, what the impact of that is.
Mm.
Um, that was one. I think the other thing is that, you know, externally, he started feeling, and Loy has been at Tanner for over 30 years. It's
Yeah.
a very tenured CEO.
You
Saying,
don't hear
we're
that
going to
too often
get,
nowadays.
you don't, you don't. I
Very
mean,
rare.
there's 4 or 5 years,
Handful.
folks have a
Yeah.
good run.
Yeah.
He's been around for a long time when it was one hospital in Carrollton, Georgia, and now it's five hospitals, $1 billion net patient revenue. I mean, it's an unbelievable story. But he's always looking around, and back saying, like, okay, is there going to be somebody else that's going to get me? Is Piedmont going to acquire me? Is there going to be all these different things that could come up? And if I don't do something about it, if I don't engage my folks to be able to make it happen, they're not going to do it.
Yeah.
And so he wanted to create the platform to allow these folks to say, I've got this problem. Steve, we've got a SWAT team now that can go out and solve this problem, not with the large companies that always do it or have
Yeah.
salespeople knocking on your inbox to try to get in the door, but with
Hmm.
these companies that may be doing something that won't pan out or we won't know whether it pans out for 2, 3 years.
Yeah.
And can we find that? And we went in fully. on that vision. I used my product background. I was like, okay, what are the biggest problems we have? We found 10, 15, 20 problems immediately when I came in. I'm like, we're just going to have to go. We've got to do automated medical coding. We've got to do, because we don't have enough coders anymore to continue
Right.
coding all of these cases and getting them out in a timely way. We've got to start looking at how do we help with scheduling and kind of managing growth around an organization that's growing 10, 12% a year into the types of places where we're going to see the highest margins. There were so many different problems that we went after, and systematically we just started saying, okay, this is this partnership, this is this partnership, this is this partnership. And the way that we structured these partnerships, to get back to your original question, is we said, okay, we don't want to really put in cash up front. We're a small system. We're super conservative with our finances. We want
Yeah.
to see if this works. And if this works really well, we are going to be the most loyal partner you can imagine. We're going to validate it. We're going to get it through the ITQ. We're going to make sure the business owner that had this problem is going to go to war for you in the organization. And we're going to hopefully help sell it to all of our colleagues at hospitals in Georgia and the broader US. And, we hope that you find that partnership helpful as opposed to just a check for $1 million and maybe a logo. Like, what does that mean for your business? And for me, that was a natural extension of what I wanted at Fiona. Is I just wanted somebody to give me the chance, right? And say, here's some contract
Yeah.
value, here's some validation, here's some time, here's some energy, here's a cheerleader in the organization to make it happen. And most organizations, people don't care. They're not incented to care.
Right.
Especially at the director or VP level, that are just, they're in their own zone. They're doing their own thing. There's a million other opportunities. But yeah, Healthliant changed that a little bit. But that's a little bit of how we do it. And there's a
That's,
lot of lessons in between there that go
of course.
way deeper on that, right?
Yeah, a couple comments. One, love how you kind of prioritize the problems. Are you finding yourself still continuing to prioritize those problems? And how often
Mhm.
do you go back? Is it like quarterly? Is it every 6 months? Just because things are changing. So I'm just curious as
Yeah.
to how those stack differently and what the duration is of when you go back.
I mean, the first year that we were doing this, we were like, okay, how many problems do we have? Like, can we just start knocking them off the list? Because we didn't know what our inventory of problems were going to be long term. We didn't know how quickly we could both, make the partnerships, but also deliver on the partnerships.
Okay.
It evolved after the first year when we were like, wow, we could actually get through like, you know, 8, 10, 12 IT builds every given year.
Hmm.
And that's just from like ruthless prioritization. And I've got to call out Greg Schulenberg, Dr. Bonnie Bowles, Chuck Collins, our IT leadership team. They are unbelievable operators. These are the folks you want on your side to be able to kind of marshal a team forward under a vision.
Hmm.
And we figured out that we could accelerate things pretty quickly. We're like, okay, so then prioritization isn't really as much of a problem if you could do 10 of these years. It's a bigger problem if you only can do 3 of them each year.
Hmm.
And so we started looking at almost capacity controls in the second year and the third year, where it's like, we don't want to have too many partnerships close at the same amount of time. We want to have it so that it's spaced out, but folks understand that we care about what they're doing. It's just going to hit a timing thing and all of that. That's
What was
been
the
the thing
limiting
that
what was the limiting factor though to go from 3 to 10? Because that's like, it's pretty big jump.
so many limiting factors that we had to run into. So contractually, that was really hard to make work. If you're doing master service agreements, you're doing BAAs, you're doing NDAs, you're doing security reviews, you're doing implementation guides. I mean, that became an exercise in parallel process to do. How do you
Hmm.
do all of these things at the same time? And IT teams do that today. It's just they're not necessarily looking at it this scale. So we figured out ways to do it in parallel on the venture side that meant that we could increase the speed. And once we had enough speed in the organization, we could start promising that speed to companies later on. And that's when the companies that were maybe pre-seed or seed stage companies we can now start getting Series A, Series B, more developed companies that said, wow, this speed is a real advantage. But also, I've done this before. I've implemented this before. So it was easier for our IT team to take on more. So it was
Mm,
almost a virtuous flywheel that by proving the results in those early stages, it meant that we could actually take on more later on from companies that may have been a little bit outside our bailiwick
mm,
in that first year.
mm. So you're going through this. You're digging into different problems, different companies.
Mhm.
You're running pilots, across various areas. You mentioned coding. Um, Pick one. Pick one that surprised you the most. You know, tell me that story.
Surprised me the most. I mean, we've
Yeah.
had some ones that are really good, really, it's some that have taken longer to
Okay.
prove.
Pick.
I
It's your
think
episode. You
that
do it. Tell me what you want.
let me tell I guess I'll tell you one that I'm very interested right now because it's actually our first medical device. And this was one of the harder ones to do.
Mm,
Is that we work with a great company called Kent Imaging. Pierre Lemire, they're out of Calgary, Canada. They've built an unbelievable wound care product that what
hmm
they do is it essentially uses infrared vision um, in a camera to detect the oxygenation of a wound and maybe the bioburden of a wound. You use that in your wound clinics and trying to see how folks
Right.
work through it. It was a really good partnership from the get go, understood exactly what the value was. He wasn't sure, I think, at the beginning what a health system could provide. But I
hmm
think over time, as we started buying more devices and using it for different use cases, it was like, well, our folks really like this. Um, and we had to build a brand new Epic implementation because they connected into Wound Expert, which is what all these independent wound care companies work with. They don't
hmm
do anything really with health systems. So we had to build that from
Right.
scratch. We realized, okay, that was kind of a limiting factor. I mean, originally, when we were just starting with the pilot, the machines could only take data from a USB stick into the wound expert computer. Right. And our nurses were going back and forth with this USB
Oh
stick.
my
Eventually, we
gosh.
created the connection there. Now we're getting into Epic implementation on that side. And so like you have all these steps, you're like, really? USB stick 2025? Like what are we doing here? That's going to be a limiting factor. But I think what we're really excited about is that the way that we structured the relationship, we could do there was some opening for some co-development on new things. And Kent
Yeah.
Imaging is an FDA approved device. They have reimbursement codes. They are later stage by any stretch. I said, what we think could really open this up is for hospital acquired pressure injuries. Is that if you're documenting
Mm,
using these devices, saying, okay, somebody's presenting on admission, let's take a look at the heel, let's take a look at the hips, let's take a look at all of this, document it. This is the thing that takes you from buying 5 or 10 devices in a health system to buying 50 or 100 devices. If every
right.
inpatient admission is getting documented for a pressure injury present on admission. And that's been the real interesting evolution. So we're kicking off our clinical study on this side. We've got our chief nursing officer involved, our head of quality. I mean, these are folks that didn't have the problem to begin with because the wound clinic certainly did.
Right.
Um, but it eventually moved into some totally different part of the organization, utilizing a tool that nobody would have thought would have worked in that particular way. So I think that's more of the kind of
But
driving it through.
but 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 you had to kind of lift it. You know what I mean? You had to
You
kind of
did.
create the awareness of that to your team internally. So there was clearly energy and effort on your part to get that type of alignment, I would imagine.
Oh, there absolutely was. And I mean, maybe I'm kind of going a little bit quick to get to the outcome, but I mean, there was a lot beyond just the pilot. I mean, our pilot manager had defined very specific KPIs. What are going to be our patient population that we're going to see week over
Right.
week, how their wound is progressing? Are we seeing the encouraging signs on that and maybe on referrals to cardiothoracic or some of these other vascular surgeons on that end to say, like, okay, can we maybe avoid some circumstances where there'd be amputations? Can we look at
Mm,
diabetic foot ulcers with this? Can we use this to drive hyperbaric treatment? There were so many different KPIs that built up confidence bit by bit to then say that, well, this isn't just a solution that works here and we're happy to buy the devices for this piece. It's, okay, I'm now having enough reps with this that I can move it somewhere else or
yeah,
expand the vision somewhere else. You only really get that if you're doing the work. Um,
100%.
and that's, I think, where a lot of it is like, well, if we're not the ones tracking the work from the venture side, I mean, it's the business leaders or the clinical leaders that are doing the wound care work. We're bringing that back. We're elevating up to the executive team. They're then able to say, well, I'm not sure whether this fits, but maybe it fits over here. Let's go explore that particular
Hmm.
direction. I mean,
Yeah,
that goes back to the whole point of you've got this small innovation at a manager director level. It goes up to executives, it goes over and then back down. But how do you turn like what could be a single or a double in a partnership to a home run? And I think that's where we're going with Kent Imaging is we're just taking something that we thought was the kernel of something great and it goes somewhere else, more broadly.
fascinating. On the other side of that spectrum, um, has a pilot failed? And if there are any that you're able to talk about, what did it look like, and kind of what'd you do with those learnings?
Yeah, I mean, we've had ones that have not worked in the implementation phase because either the amount of resources to get it up and going were going to be really cost prohibitive. Can't
Mm,
really talk about a couple of those. Those are harder. We don't really publish our results until we see pilots. I think we've
hmm.
had areas where we've done some co-development work and the company pivots and it doesn't no longer make sense to really be a partner with them because they're not going to a health system style go-to-market
Yeah,
strategy. They'd rather
yeah.
go B2B. I think one is, and this is a lesson potentially for entrepreneurs that are trying to get into health systems, is that you really have to find champions that can be the owner from an operational level, not just the champions that are there as like the
Mm,
rah, I'm going to get it over the line from a budgetary perspective.
yeah,
Um, Great company. I actually just got off the phone last week with their founder, Jessica Walker, Care Sherpa. They were this
yeah.
referrals company.
No, no, I know
I think you
Jessica. She's
you
great.
know Jessica well.
Yeah, yeah,
And
she's good.
we've been working on this for 2 years. They were one of our earliest deals, right? And they came into the organization not with the operator. It was almost like we have this great technology, we have this great service, we don't really know where to put it. And so we started in our hospice line, and our hospice folks were like, I don't know whether I really like it. They didn't work well together. And, they were really trying to figure out how to make it work. But it was like,
Mm,
we're pulling things along. And it feels like you're pulling this over the finish line. That's not really the great. So we shifted it and we moved it towards mammographies.
mm,
Different leader in the organization, different side there. Because we thought that there was improvement on the hospice side, but it wasn't like the 6x, 12x ROI
yeah, it
that you're
wasn't like an
looking for.
asymmetrical, risk. It wasn't like an
That's
outsized thing.
exactly it.
Yeah.
And that's exactly it. And we're so impressed by Jessica and her team that, we're like, okay, we've got to figure out a way to do this. And so we did mammographies. Our director of imaging was instrumental to this. Patient access folks were instrumental in this. And we're like, okay, we're going to do this repilot on the 6 month side. And, we just announced it, last week that it's like it was overwhelming success. Our,
Nice.
drop in resources from our patient access side was like a 40% reduction in resource utilization. We've got significantly more folks coming in for mammographies on an annual basis. That obviously has huge effects on kind of our breast surgery rates elsewhere. And
Yeah.
more importantly, our head of patient access is like, I really trust Jessica. I really trust the team. That's the real win for us is like when you can get that culture fit. And so I won't necessarily say that it was a failure, but it was not where we thought we would see success. And it's like, do you have the ability to get that second chance to really show the value. That's you sometimes don't get that. And
Yeah.
I think we were able to turn what was, something was like, okay, this may not be the thing that we want into something that like our CFO is raving about in a great way.
Yeah. What's cool that you all course corrected. You didn't just sort of say, well, hey, we have something here. We have a founder that we think is dynamic, and she is dynamic. She's awesome. Um, and let's see if there's another way that we can reconfigure this. Let's look at this differently. It's just cool,
Yeah.
really cool to hear that. Because you've sat in the seat, and you now I can only imagine your inbox must be disastrous, people trying to grab your time. And you sit across the table from, startup CEOs. What do you see that founders get like wrong when they're trying to get into a health system? And I guess if there was like a version of your younger self that you were talking with right now, what would you tell them?
Yeah, I think most founders don't understand the internal dynamics of health systems, or at least can't appropriately like kind of fake it until they make it.
Mm,
They don't understand the financial realities. They don't understand the intersection between what a clinical leadership wants versus financial leadership wants. They don't understand whether the champion that they've identified actually has the ability to get something over the line. I think that's a really big one, is that you have a
yeah,
lot of people that are super excited about a particular innovation or solution, but they have no foresight into all of the crazy brick walls that are come up when you actually have to get it like a
yeah,
contract signed. You have
yeah,
to get so many people in the room to make that happen. And if you don't have somebody that knows how to do this and has been in those shoes before, hard to make it work. I think the other thing too, and I think this is not talked about enough, but I think it should be, and it's a good way to say, okay, it's approximation of like this is taste from the health system side or the venture capital side or
right,
whatever,
right,
is that culture fit is huge in these types of
yeah,
things. If you're going after just academic medical centers, that's a totally different culture fit than it is going after regional communities, right? It,
totally,
it really is,
yeah,
really is, because you're
day
not
and night,
understanding the incentives that we're under. You're not understanding the way that we think about our community and what makes us look good in our community. We're not looking for research success. We're looking for patient outcomes. We're looking
hmm
for financial success because a lot of the times, if you look at Tanner, I mean, we are in Carrollton, Georgia, and Villa Rica, Georgia, and Wadley, Alabama. We are kind of one of the economic engines of our community,
yeah,
and so that culture fit is huge. And so when you find the champion that knows how to get it through, it's a culture fit. They want to work with you, and the organization wants to work with you. You're going to sail through a lot of these processes, but you don't really
yeah,
know whether it's going to work until you feel it.
hmm
um, you'll feel the
yeah.
pull. And that's where the product market fit really becomes most interesting and most kind of viable in most folks' minds.
So you've been the one that's been pitching. You've also been the one that's being pitched to. Which one is harder?
Pitching is hard because, say both, right? Pitching is hard because you feel like it's a one shot thing, right? It's like you've got to make every moment count and you feel the judgment on that side where you don't have a lot of leeway in terms of what you're saying or and you think that it could be a lot of personal type pieces when a lot of it is it's a thesis fit or something of that
Yeah,
nature. When you're on the other side, and I think it's especially hard being on the health system venture side,
yeah,
is that there's a lot of folks that I'm like, wow, that's an unbelievable founder. That's an unbelievable company, but I don't have that problem right now at Tanner. And maybe it'll come
hmm
up in a year from now, and maybe we'll have this work again. And we've had a few of those where it's like met with them a year and a half ago. Time to kind of re-engage at that point. It's
mm,
hard to be the guy that says no without going into a lot of details as to why. Um, I respect the kind of game on the other side a whole lot more being in it. Because sometimes I have to just say, no, it's not a fit. No, I can't really tell you why, because telling you why, indicates that maybe you're just kind of going down a wrong path, or this market may not work out for you. I don't want to be the one that tries to kind of extrapolate my individual health system experience
Hmm.
to everybody else's, because once you've seen one health system, you've only seen one health system.
Yeah, yeah. Facts. Absolutely. What is before we kind of wrap, I'm just curious, what is the best way for people to follow the work of Tanner and Healthliant? Give us like a little commercial and how we can follow you and the things that the team are doing.
Yeah, so I mean, we're pretty active on announcing our partnerships on LinkedIn. I'd say we try to give a pretty strong rationale when we're announcing these as to why it's important to us, not just why it's a good company,
Yeah.
but why it's a good investment, but like what's the actual problem that we're looking to solve. I think, I'm not the best at social media. I'm not the best at kind of saying, oh, look at
Hmm.
this, look at what we do. I tend to be a believer in doing the work. And I think that that's also a Tanner
Sure.
thing as well, which is we don't like a lot of self promotion. We're good at what we do. We've got great margins. We have great outcomes. We're a real interesting health system in that regard, but we don't like to go on kind of the circuit. I'd rather be able to say, hey, how can I make sure I reflect the Care Sherpa story or the Kent imaging story or one of
Yeah.
the dozens of other stories that we have at Healthliant in kind of a one-on-one connection at a conference or somewhere else, where I can very much tell the story to my counterpart at one of our many health system partners. That's the thing that for me is like the most gratifying, to say like, hey, we got that one over the line, on that side. Um, yeah. In terms of following us, though, I mean, I love talking. I love talking about the industry. I love talking with our venture studio partners, our venture capital partners about what's next. Um, I just love to have a conversation
Yeah.
about it, because I'd love to learn new ways that I'm either right or wrong about things. Like,
Hmm.
what's more evidence around like how we're thinking about the world that could be totally off? Because I think healthcare is changing and it's becoming harder year by year. I think the last couple of years have definitely proven that.
Yeah.
Um, so if we need to zag where others are zigging, give me that kind of knowledge
Yeah.
to make that informed position. And I definitely, appreciate any of that kind of candor in the conversation.
Yeah. If there's anything I take away from this conversation today, it's look, sometimes there's bits of information that you just don't have, so you don't want to assume. Because to get something over the line
Mm-hmm.
into a pilot, into a commercial arrangement with Tanner, there's so many different milestones that have to happen. There's lots of different moving parts, and at any given time, there could be something that could derail it. And for a founder to kind of go in thinking that it's linear would really be a disservice to them and their company. There's obviously lots of little milestones along the way, and sometimes, like you said, there's zigging and zagging, but there's
There
just
are.
so much orchestration that's going on behind the scenes underneath the hood. And I'm just actually really glad that you even illustrated a couple of those opportunities and what it, really kind of what it took to get it over there, because I don't necessarily think that people are seeing that. I just think
Yeah.
that they feel
It all
like, all
comes
right, we
back to
well,
relationships. It
it
all comes
honestly
back to
does.
relationships.
Yeah.
And it's, do you trust the person on the other side to follow through with what they said?
Yeah.
And I mean, there's so many milestones you go through. It can make your head spin. But
Yeah.
if you're treating it not as a transaction, but as like the flourishing of a
Yeah.
relationship,
Yeah.
then it makes it easy for folks to go through it. It's like, hey, listen, this may push back by a few weeks or a month, but it's like there's some times where we've had delays for a whole host of reasons, but both sides still trust that we're going to get this done.
Yeah.
And
100%.
that's what matters in this,
Yeah.
because
Hey,
otherwise, like, you're just treating it as another step to get to somewhere else, and healthcare doesn't work that way.
that's for sure. I'm just gonna mic drop that. So for those, if you were listening and you found this conversation to be helpful, what's the best way for you to be able to support this? Number one is share it. If you don't mind, share it. Share it, comment on it, like it. maybe personally send it out to a couple people that you really value their opinion. That might be helpful. And if there is a topic that you want us to explore, or even a leader that you'd like to hear from, drop me a note, leave a comment. Certainly do read them. This is a platform that isn't just about content. Like this is an actual interactive community. We are very intentional about it. So thank you for listening, Steve. Thanks for joining. And again, guys,
Appreciate it.
keep building with purpose. We'll see you next time on the Advancing Healthcare Innovation Show.